Hi, I'm Jason James, team number 34. I have a daughter who just started high school. She and her friends talk quite openly about mental health. When this topic comes up, my wife tends to be more supportive of having these conversations than I am. My daughter and her friends haven't spoken much about mental health resources or support that is available at school, though it did get me wondering if mental health in schools is supported more by women than men. What made me think of this as a research topic? I see the need for more mental health education as part of a child's normal education. School is the best place for children to receive mental health support. School shootings on the rise, more anxiety in our children, time spent in school already. But I wondered if men and women would think differently on the topic due to their nature nurture differences. Overall, the existing literature pointed to school mental health interventions being beneficial for students, but the research of whether females support government funded mental health education more than males was non existent. What I found interesting was the amount of studies done regarding stigmas associated with students receiving treatment for mental health services at school. Stigmas were related to whether students asked for treatment at school from non mental health professionals and whether students felt they could ask for help. This statement stood out to me. There is moderate evidence suggesting that school based mental health interventions can be effective in improving mental health literacy and reducing mental health stigma defined as attitudes and beliefs regarding mental disorders. My hypothesis was females tend to support government funded mental health education for school aged children more than males, and the variables, genders including male, female, non binary, and other. In my survey, the data showed that all participants either chose female or male. None of them chose non binary or other. This helped my data be more clear since my belief statement isn't itself didn't include non binary or other. In the future, it would be important to consider whether the question should ask for participants to only choose male or female. Perhaps, if a participant responds as non binary or other, they would automatically end the survey in order to keep the data true to males and females and their views on government funded mental health education in schools. The interesting trends that came from the survey results were in how many females were neutral about the statement and how many males strongly agreed with the statement. In other words, if most females surveyed have no opinion on if females support mental health in the classroom, does that reflect on their personal views of mental health in the classroom? In looking at the chart, 58% of males agreed with the statement that females tend to support government funded mental health education for school age children. 50% of females agreed with the statement that they tend to support government funded mental health education for school age children. There is an 8% point difference between males and females when they considered whether they agreed or disagreed with the statement. Again, as I looked over this information, it made me realize that the belief statement did not truly get to the attitude that I wanted to know about the participant taking the survey. It does shed some insight on a person's attitude about the statement, but not their personal belief about whether mental health education should be offered to school-aged children. Seeing the data split almost right down the middle tells me that the statement itself could be confusing. Although, if we see that 58% of males agreed with the statement, it could be assumed that males do not support government funded mental health education as much as females, but this still requires further survey research with clear questions or statements to make this assumption. As I thought more about my hypothesis that females would support mental health education in schools more than males, I also began to think about who pays schools in the first place: taxpayers. This would also beg the question if the respondents had children in schools themselves, if they were homeowners, and if they had their own children in public schools. The hypothesis could be narrowed down to include opinions that female homeowners with children support mental health education in schools more than their male counterparts. But that would be introducing more than one variable, which could cause confusion as well. With the sample size being relatively small, it was probably a good idea to not include whether participants had children and/or owned homes themselves. As I sum things up here, it seems to me that from my survey research, males tend to agree that females support mental health education in schools. Females are in agreement and are neutral with the statement. Clarifying the belief statement in the future in order to truly research the attitudes and opinions that I'm seeking in my hypothesis is needed for less confusing results.